Cell phones can be a constant distraction in our daily lives, from driving to merely walking down the sidewalk. But you have to shut it down sometimes, right? Well, a New York woman is suing a surgeon because she claims he used his smartphone to take a Spanish language test while he was operating on her. Allegedly, the woman was under local anesthesia for a varicose veins procedure. She says she heard the entire Spanish lesson, and according to her lawsuit, when she asked the doctor, he told her that her varicose veins operation coincided with the only time he could take the oral exam. Bueno or no bueno?
No bueno.
I just think, like,
horrendous.
What are you thinking?
The lawsuit cites the 2016 statement from the American College of Surgeons that the use of cell phones in operating room may pose distraction and may compromise patient care. I think you could go ahead and take out the may. Cell phone poses a distraction, and it does compromise patient care.
It's a huge HIPAA violation if there's anything on that cell phone that shows any part of that patient. That is a huge no-no HIPAA violation.
I don't care what you have to time. Like, if you're in the middle of a procedure on a patient, there is nothing that should be superseding your attention.
Right. Why is the phone even in there?
I've seen this over my career. I've worked with doctors that wore headphones and talked on the phone while they're operating. I find that disgusting.
And what's scary is I've been seeing photos of patients in the operating room. You know, people are taking social media pictures apparently in the surgery room. I'm seeing some of that too.
Wait a minute. We promised we weren't going to talk about social media pictures, but well, you know what? It came back to us. It comes back
up. And you know, a story we've talked about on this show, our dear friend Joan Rivers, that it was documented that in her case in New York, in that surgery center, that cell phones were out and people were recording selfies and things like that, and we weren't there. We don't know what happened, but an event happened. And
you know the other thing about cell phones,
there's no place for cell phones.
And it's not even just the distraction of cell phones. We've documented on the show before that cell phones happen to be one of the dirtiest things in our lives, dirtier than your toilet seat. And so
100%.
What is a cell phone that literally has every possible germ from the outside environment doing in a sterile environment of an operating room is sort of beyond me. I know not the entire operating room is sterile, but that concerns me. And my question for you is, in a case like this, she is filing a lawsuit. It seems like look, as physicians, we have governing bodies. It seems like wherever he is operating, I'm surprised that the surgical center where this individual operates is not engaging in some sort of, I don't know, rescinding his ability to practice there until there's some proof that he can do so in a safe manner. Because it's not like you can just roll into an operating center and say, hey, I'm going to operate here tomorrow.
No, of course you have to be credentialed wherever you're doing.
So my question is, don't operating centers and hospitals, don't they have their own set of rules?
Yes.
Absolutely.
So that's my question.
Working on veins, he probably was just doing it in a treatment room and not necessarily.
And that's probably
why. I mean, I think it was probably, since it was under local anesthetic, not necessarily in such a controlled environment.
That in a properly run hospital or surgery center, that the charge nurse would never allow this to happen.
True, even in your own office, you would never do this. I mean, it's just one of those, like, just golden rule. Like, if you have a scalpel or you are actually opening up a patient in whatever capacity, it just boggles my mind.